Trust me. Trust your brother. Okay. But no. Oh, it's not over. When this is over with, when this is over, I'm gonna call you. I'm actually. Heads up, guys. So, yes, this thing's really starting. Bye bye.
Wait for Kim. Is Kim? Is Kim coming?
Kim, come
That was almost a bad situation right there. Well, good morning, everyone. Thank you for your presence here today. We had a very robust discussion at the caucus meeting at the growing threat that is presented by the coronavirus. The coronavirus is clearly a national emergency. It requires an all-hands-on-deck approach. It requires engagement from everyone, from Democrats and Republicans, from the House and the Senate, the White House and the administration. It requires engagement at the city, state, and federal level. House Democratic Caucus, great leadership from Speaker Pelosi and Steny Hoyer, and our members are committed to making sure that we do everything possible to both contain the virus and then to mitigate it as it emerges in jurisdiction after jurisdiction. We heard from Chairwoman Nita Lowey, and our goal is to make sure that we do not leave Washington this week without an allocation of resources to deal with the coronavirus. It is our expectation that that number would be substantially greater than the amount requested by the administration, and that it will involve new funds, not a reallocation of existing funds. Chairwoman Lowey has been working with her counterpart in the Senate, and it's our hope that we will have a bill on the floor at some point in the next day or two. We also heard from former HHS Secretary Sylvia Burwell with a detailed analysis about the situation that we face, some of the lessons that we as Americans have learned in terms of addressing viruses and outbreaks connected, for instance, to Ebola and Zika in prior years, and how those lessons can be applied in confronting the coronavirus that we face right now. With that, let me yield to our Vice Chair, Catherine Clark.
Thank you, Mr. Chairman, and good morning. As the chairman said, the House is working to advance a strong emergency funding supplement package that will fully address the scale and seriousness of this public health crisis. Dr. Fauci will also be coming back before the House Appropriations Committee tomorrow to answer our questions about how we can best make sure that Americans are secure and healthy. But with an outbreak at our doorstep, it's important to recognize the risk that our nation runs when basic necessities like health care and paid family leave are out of reach for so many American families. Just this week, we will be extending to TSA workers the full protections of being federal employees under Title V. This means they would be eligible for paid family leave, but we already have a notice of veto intent from the White House. This same week, the White House is in court attempting again to dismantle the ACA and advocating for their budget proposal that would severely underfund Medicare and Medicaid. So expanding health care quickly becomes, in a crisis like this, not just the humane and right thing to do, but it becomes a question of national security. And we cannot let this be jeopardized. We must continue our work to ensure that basic affordable care is in reach for families and for workers. And we are very, very glad to have with us today two of our members of Congress who bring tremendous background and their medical expertise to their work every day, and who we are relying upon during this time of threat to the health of the American people. So I'm very proud to introduce, to begin, Congresswoman Kim Schreier from Washington State, where we're seeing a real outbreak. And Kim is a pediatrician, and delighted to have her with us today.
Thank you. They say that pediatricians are practically infectious disease experts. Good morning, and thank you for your attention to this quickly evolving situation. We are all understandably worried right now. First, before I even start, I just want to extend a big thank you to our public health officials who have been working around the clock, to our first responders who put themselves in danger's way every day, to doctors and nurses and others who are working in the hospitals taking care of ill patients, putting themselves potentially at risk, and also to researchers who are working on vaccines and treatments, including in my home state of Washington at the University of Washington and Kaiser. Second, being from King County, Washington, I want to extend my sympathies to the families of loved ones who have passed from COVID-19. And then third, I wanted to turn my attention to everyone else at this time of uncertainty and worry. We've known from the start that COVID-19 would come to the United States and that it was a matter of when and not a matter of if. And that is why preparations have been ongoing. We know for sure that this disease will spread, especially at the beginning in urban and suburban areas, and it will get worse before it gets better. We all have a role to play, and we need to do our part. There are things that we can do to limit the spread and protect our communities, and these should not be underestimated, even though they're simple. They also should not be dismissed by people who consider themselves low risk because of their age or their health. This disease can be very serious for certain populations of people, and it is incumbent on every one of us to do our part to slow the spread as much as possible. That total containment is not likely. So to slow this disease, we need to all do our part. And these are simple steps that you've already heard a million times. Wash your hands, wash them well, sing the birthday song twice, get the fronts, the backs, and the thumbs. If you're using hand sanitizer, put a lot on and rub until they are dry. Don't touch your face, particularly eyes, nose, and mouth. That's how you spread it. Stay home if you are sick. Even if it is a mild sickness, we all need to err on the side of caution and keep a distance from ill people. I anticipate that there will be more recommendations to do things like canceling large gatherings, sports events, concerts, and the like as this spreads. I would prepare yourselves in addition for things like school closures, workplace closures, and just start planning now if you haven't already. For people who take medications, try to have at least a month extra supply on hand. And I would say the same thing about food. A week, if not a month, of supplies in your house if you can. We'll depend on neighbors to bring things if we don't have them. So think about also the choices you make daily now already about whether you shake hands or whether you elbow bump. And what you do now really will depend on your own personal risk. If you're elderly or you have underlying medical conditions, you may want to make more changes now. You may want to already avoid large public gatherings, avoid unnecessary travel, and certainly if you're sick, stay home and don't visit loved ones in the hospital. Recommendations will change every day. We know that for sure. So get your health information from trusted sources like the CDC and like your own public health departments. Remain calm, don't panic, and we will get through this together. Thank you. I would like to introduce my colleague and partner in crime, Lauren Underwood, my favorite nurse, only nurse in Congress. Thank you, Lauren.
Should be your favorite.
My favorite nurse.
Thank you. Good morning. It's so great to be here today as a nurse and as a public health expert. When it comes to this coronavirus, the most important thing I want to stress to the public is that now is the time to prepare, not panic. Prior to being elected, I worked as a senior advisor at the U.S. Department of Health and Human Services and the Office of the Assistant Secretary for Preparedness and Response. In that role, I worked on the department's responses to public health emergencies like Ebola and the Zika virus. I remember feeling the weight and gravity of our work, of knowing the American people and the world were looking to us. The threat was grave, but we took it with resolve, with focus, and with coordination. Our communities were left stronger, and we must do that again. That means ensuring an all-of-government response that builds sustainable capacity within our local public health systems. That is essential, as is relying on experts and putting them directly in front of the American people to communicate about steps that they can take to minimize their risk of infection and to prevent transmission to others. We need to support the essential role of state and local public health officials with more sustained funding. I convened a call with those in my community last Friday to gather information about what they're seeing and hearing and to thank them for their work. These are the people truly on the front lines. I'm so proud of the work that they're doing to protect our communities. Here in Congress, make no mistake, we will answer this call with the policy direction and the resources required to fund an all-of-government approach that supports state and local government response, guarantees affordable vaccines for all, and prioritizes COVID-19 response without diverting funds from other essential public health needs. The safety of our community depends on it. Thank you.
Thank you, Lauren and Kim. Any questions?
Mr. Chairman, Vice President's going to meet with the Senate conference, Republican caucus, and Democratic caucus. Is it important for your caucus to hear directly from the Vice President and how the administration is dealing with this disease?
At some point, I would expect that there would be a broader discussion with the Vice President, but I do know that he has been in regular contact with Speaker Nancy Pelosi. Yep, second row. Yeah.
Thanks, Mr. Chairman. Can you tell us a little bit about what's happening here at the Capitol? It's a busy time. There's a lot of visitors here at the Capitol. Are there any steps being discussed about just containing the virus spread?
Well, it's certainly the case that the leadership, as well as the chair of the Committee on Administration, Zoe Lofgren, have been thinking through all of the possibilities in terms of how to make sure we can keep everybody safe and healthy. You know, our employees, our staff, our visitors, the everyday Americans who come to the Capitol, and we look forward to them continuing to be able to come to the Capitol. Dr. Monahan, who's the attending physician, also provided us with a briefing earlier today, just reminding the caucus members of best practices, many of which were laid out in an eloquent fashion by Dr. Schreier in terms of what all of us should be doing, thoroughly washing our hands, also making sure that we minimize contact with individuals as feasible. We're still working through the question of transmissibility, and to the extent that there are some unknowns, we all have to proceed with caution.
The President is calling for a payroll tax cut or other stimulus measures. Is any of that under discussion here in Congress?
There hadn't been any discussion that I've been a part of related to any stimulus proposals that the administration may be informally discussing. I've seen no formal proposal. I don't know if Catherine wants to comment on anyone.
One of the issues on supplemental funds, I understand, is vaccine affordability. Is that something that has to be addressed in this bill, or because the vaccine might be a year from coming to market, could be addressed in other legislation or the regular appropriations?
Well, we're going to take a substantial first step, and it's my expectation that the supplemental will be very robust in terms of the amount that is allocated. It will be done in a bipartisan way. Everything is on the table, as I understand it, but this will not, this is a substantial first step is the best way that I can phrase it. I don't know if Dr. Schreier, you want to comment on Lauren?
I would just say that I think of our current investment as a down payment, and that at this moment, top of mind for all of us is just thinking about public health, getting the vaccines out there, and we will figure out how to get them to people so that cost is simply not an issue. This is about protecting the public.
I don't think that we have any one issue at this point that we want to hold up getting this money to our local and state officials as quickly as possible. But the vaccine issue, as we are looking to move as quickly as possible into development, which could mean still a year away, is part of the overall access to health care. And we have grave concerns about people who may go to work ill because they don't have a choice to stay home and be able to pay rent or a mortgage or put food on the table. And we have grave concern that people will not seek the health care they need as we may move from what we are, the phase we're in now, which is really about containment of the virus, to potentially moving to a phase where we are really trying to mitigate and make sure that we are saving lives. We need people to be able to access this health care. We're already seeing surprise billing popping up for families around the country who had the tests done, were required to have tests done, and now we're facing medical bills of thousands of dollars. So this is all part of how we deliver health care and how we see building a public health infrastructure as part of our national security plan. As I discussed with Secretary Azar last week, we cannot do this planning once the crisis is hit. And the one thing we know is that the coronavirus is not going to be the last public health threat to this country. And those investments in quality, affordable, accessible health care are a critical piece of being prepared.
The only thing that I would add is we know that the vaccine is one part. The other part is affordable treatment and affordable diagnostic tools. These are a package of things that the American people are going to need in order to be able to move forward through this coronavirus outbreak. And so as part of the appropriations process, it is our expectation that care will remain affordable for the American people, and we're going to continue to negotiate to that end. Thank you.
Back row.
Sorry, again, it's more for the medical experts. What you were talking about a moment where we might start canceling large-scale events. What would be that? Is there some sort of red line, some sort of tripwire where you, in your medical opinion, would say that's something that we should do, and especially here in this community, the capital itself?
I don't know that there's a red line. In fact, I would say that it is a blurry red line. For people who are at high risk, they should just not go now, even without official closures. And I think that we are.
Not just Washington State and County.
I suspect that we will see this in coastal and large cities first. People can wait to see if there is an outbreak in their communities, but some of the reason that we know we have an outbreak in King County is that we've been testing. And so I would say I don't know the red line, and I would look to our excellent public health officials to know when that red line is. But for people at high risk, you make that decision for yourself right now, and you can choose whether to go to a crowded sporting event or concert or to sit that one out. And frankly, you might want to sit that one out.
Other thing that I would add is that the Centers for Disease Control and Prevention is doing daily updates, including new guidance documents for the American people, for local public health experts, and for providers. Just yesterday on March 2nd, they released new guidance called Getting Your Mass Gatherings or Large Community Events Ready for COVID-19. And we're going to continue to urge everyone with questions to take a look at trusted resources like the Centers for Disease Control and Prevention at cdc.gov.
Yeah, there's a balance between normalcy and precaution, and we're going to have to strike that balance, but it should be guided by our public health experts as they monitor the rates of transmission, the testing, and the awareness. But as both Lauren and Kim indicated, if an American is feeling symptomatic, if an American is feeling flu-like conditions, it's very important, obviously, to get the health care and access to affordable, high-quality health care necessary. But we're going to need the American people to conduct themselves in as responsible a way as possible, given all of the uncertainties connected to the virus.
Travis, can you talk about the fate of FISA? It doesn't seem right now that this would be attached to the supplemental that's going through this week, it's just too fast. But what is the path forward for next week, given that that is effectively the deadline for this program? Would the House Democrats be willing to see that lapse?
Well, it's not my expectation that it will be attached to any legislation that is moving this week. There are ongoing discussions being led by Chairman Schiff and Chairman Nadler to see if we can get to a point of reauthorization in advance of the March 15th deadline.
Should Americans be concerned to travel right now?
Well, I mean, I think, again, public health experts are going to have to weigh in and make those decisions. I can yield to our resident public health experts who are here, and we're so thankful for their expertise, their thoughtfulness, their intellect, and their experience, but it's not appropriate for me to weigh in on that point.
Well, as you know, the administration has made some changes to the travel advisories. We do urge the American people to heed those recommendations, particularly when it comes to travel abroad, as the American people navigate their own communities and do ongoing work and business, which might include airplane travel, for example. We encourage everyone to get a flu shot, right? Like things that we know are good public health measures that they should be taking in day-to-day life. They absolutely need to be taken during this coronavirus because we wouldn't want people to get, for example, both concurrently. I personally, as a nurse, would not tell people not to travel. But if, as Dr. Schreier mentioned, if folks are at high risk and they know that that they can delay or avoid certain interactions, then we would certainly encourage them to do so.
I was just going to say that the other thing that makes travel safer is that if you are sick, please don't get on a plane. You know, that keeps everybody safe. And then the usual routines of just washing your hands and doing everything you would do at home is what will keep you safe. But we are depending on everybody to do their part. And if you have a cough, it's not the time to be on a plane.
How would you assess the response from the Trump administration thus far? There's already been some calls for top officials to resign based on some of their handling of the virus, and I'm curious what you think of that.
Well, I think at this point we have to come together, and as I mentioned, it's an all-hands-on-deck approach, and we've got to find a way to rise to the occasion. That means Congress has to rise to the occasion. Certainly the administration has to rise to the occasion. And as Secretary Burwell mentioned earlier today, a lot of the effort is going to be activity on the ground. And we've got to make sure that our locally based public health professionals have been equipped both with the information and the resources necessary to address the virus. One of the concerns that we have relative to the coronavirus at this particular point in time is the transmissibility of it seems to be of a very different nature than, for instance, Ebola, where it was transmitted through bodily fluids, or Zika, which was transmitted through mosquito bites. But in this particular instance, the coronavirus could be transmitted possibly through surface contact. It could be transmitted through airborne communication, whether that is coughing and sneezing and things of that nature, could be transmitted through shaking hands and human contact. So it's of a very different nature than Ebola and Zika. And that is why everyone needs to rise to the occasion, including the administration. Yeah. Any further questions?
One more question. Can you break down where the billions of dollars is going to be going that you're requesting?
Yeah, it's a great question. That's still a work in progress, and so it'd be premature for me to comment, but we are hoping that it's going to be as robust as possible, as bipartisan as possible. We want a three-way agreement with the administration, the Senate, and the House.
Will it come up under suspension of rules, or how do you expect
That's probably a question best directed at Steny Hoyer. But we do expect to have strong bipartisan support to move forward on this issue. It's not a Democratic issue or Republican issue. Dealing with the coronavirus is an American issue. Thank you.
I have one question, though. As politicians, your main job is to fly around.
Public servants.
Well, to fly around the country, meeting big groups of people, shaking thousands of hands. Do you see this virus hindering your ability to do your job?
Well, our job is to make sure that we protect the health and the well-being of the American people and those that we serve. And we're going to do that to the best of our ability with the fierce urgency of now. Thank you.